Hello, and you're very welcome to the HRB Where Are They Now series, where we're celebrating and reflecting on 40 years of the Health Research Board. My name is Claire O'Connell, and I'm your host. And can you believe it? The HRB has been 40 years on the go, and in that 4 decades, it has supported a huge number of researchers and an enormous amount of research that is supporting and shaping health and social care in Ireland and beyond. And to mark the occasion, as the name suggests, we are speaking with people who, at some point in their career, have received support from the HRB or they reflect the HRB's priorities. And in this episode, we are joined by Dr. Elaine Toomey. Hi, Elaine.
Hi, Claire, how are you?
Great, thanks. Great. And now you're a lecturer in evidence based healthcare at the University of Galway. That's a really interesting title. What do you do in your day job?
So I suppose in my day job, like most of us, we wear like a million different hats, wear about a million different hats. So I suppose one of my main roles is I'm the program director of a relatively new Masters in Evidence-Based Future Healthcare. So that's running, it's in its second year now. So that's where that title kind of comes from. So I suppose what we're doing there is we're really working with healthcare professionals to help them use research in their daily practice. So it really does tie into a lot of the stuff I do in my with my other hats on, which is my research side of things.
And what do you do in the research side of things?
Yeah, so from that perspective, I suppose evidence-based healthcare, and I suppose that's kind of the broad kind of piece of it. And then more specifically, a lot of the work I do is like in implementation science. So how do we get research into policy and practice and the methods that we'd use to do that? And I also kind of bring a bit of a behavioral science lens to that. So again, looking at individual behaviors and collective behaviors and decision making and that type of thing as well. And then I also kind of look at how we do research, and again, bringing like a behavioral and implementation science lens to how we improve the research that we do to then implement it into practice with the overall goal of being maximizing public health outcomes and population outcomes.
Fantastic. So you're taking a lot of evidence that's maybe already out there and you are analyzing it to see, how can we actually sort of translate that to improve the way that medicine is practiced, to improve people's behaviors, to improve people's health outcomes. Is that it?
Yeah, exactly. It's basically the science of how we get research into to informing policy and informing practice.
Okay, amazing. How did you get into this line of work, Elaine?
So I guess I'm a physiotherapist by background. And I graduated in a recession when there was very little kind of clinical scope or potential for clinical practice. And so thankfully, thanks to the HRB, I had actually done a HRB summer student fellowship in my third year of undergrad. So I actually found I really liked the research and I really liked kind of the flexibility, the freedom, the creativity. So then when it was hard to get clinical jobs, I was offered a research master's post. So I took that and really enjoyed that. And I guess when I was kind of working in that, that was to do with physical activity interventions in multiple sclerosis, people with MS. I kind of felt that a lot of the times, when you do research, a lot of the research tells you, oh, the research in this field is really poor, or we can't really trust research necessarily because the methodology isn't done properly or isn't as good as it could be. So I suppose that kind of piqued my interest a little bit in research methodology. In that, well, we want good research, so maybe we should actually devote our time to improving the methods with which research is done. So that's kind of one piece of it. And then I suppose I also kind of being a physio and eventually getting to work clinically, I kind of felt that a lot of research is out there, but it doesn't always make its way into practice.
Mhm.
And so it's kind of hard to kind of, I suppose, as a healthcare professional, to know how to do that and when to do it and how to access research and that type of thing. So that's kind of the second element of it is the implementation science piece and the looking at how we then actually get healthcare professionals. And kind of in my later years, I've also started looking at healthcare policymakers to use research evidence in decision making.
And you mentioned there the HRB, the summer studentship when you were studying physiotherapy. Have you continued to get support from the HRB in your journey to where you are now?
Yeah, I've been so lucky. So after that research masters, who I continued on with my summer student supervisor because I'd liked working with her so much, so I stayed on with her for the masters. And then I took a PhD post, which was actually funded through HRB DIFA, so I've them to thank for that as well. And then after the PhD, excuse me, I was lucky enough to get a HRB interdisciplinary capacity enhancement fellowship. So I remember hearing that Graham Love, who's a previous CEO of HRB, he used to call them the Rolls Royce of postdocs, and it really was like it was just there was a separate budget for training, for travel, for dissemination, and I suppose a big part of that postdoc was developing you as an independent researcher. So I always look back on that as such a fundamental period of my life, and also such a fundamental part of my research, in that it just gave me that kind of platform to explore, to kind of develop my own independence, to do my own things, and not just working within the project itself. So again, kind of hats off to HRB for being creative and flexible enough to think of a fellowship like that. So.
Great, really invested in you as a researcher and gave you loads more skills, I suppose, and new directions. Can you give us an example of some of the projects that you've been working on?
Yeah. So, and I suppose actually since that postdoc, then I went on to be associate director of Cochrane Ireland, which was again another HRB funded initiative, and really enjoyed my time with them. And during that post, I also then applied for another HRB fellowship, which is the Applying Research into Policy and Practice Fellowship, and I was lucky enough to get that. So that is kind of that's probably forms the main part of my research at the moment, which is it's a project really looking at exploring how health policymakers and decision makers use research evidence. So part of the fellowship, I have like a placement with the Department of Health. So I've been kind of working with them on this piece of it. So yes, again, thanks to HRB for funding that. And that's kind of one of the main things that I'm doing at the moment.
Amazing. So you are looking at the research and then the policymakers and seeing sort of how the policymakers interact with the research and how they use it as part of their decision making. Is that it?
Yeah, kind of. So one of the first kind of work packages of it is like a Cochrane review of knowledge translation interventions with health policymakers.
Mhm.
So looking at what types of interventions have been done to help health policymakers find, access, and use research evidence in their decision making.
Great. And because sometimes I think, it's easy to think that there's evidence and that should be, the sum total of the decision making in health policy. But of course, health policy is multifactorial. There are lots of things influencing it at any one time. So is it a more complex picture than people usually imagine?
Yeah, totally. So, like you're dead right, there's so many different factors that influence a decision. So, political factors, financial factors, public pressure. So, lots of different elements in the decision making piece of it. So, research is just, I suppose, one component of it. So, it's kind of naive to think that you do the research, it says X, and then that it will just then, make its way into policy. So that's why kind of it takes, I suppose, proper research and proper exploration of that to see how it can be done.
How it can be done kind of effectively and efficiently. And I suppose we also live in a world where there's a lot of mis and disinformation. So, how does your work help to try and cut through that a bit and try and sort of make sure that the evidence that is coming through is actually, I suppose, better supported?
Yeah. So excuse me. Excuse me. So some of it does, yeah, for sure. And even we actually have a module in our Masters for Evidence-Based Future Healthcare, which actually looks at that. So it's patient-centered decision making or
Mhm.
person-centered decision making, and a part of that is helping people deal with misinformation, disinformation. So it's definitely a big piece of that. And with my work, I suppose there's kind of two pieces of it. So there is the methodology piece, so ensuring that the research is trustworthy and is done to to the best extent possible. And then there's the piece of then looking at, well, how do we best get people to use this? And often it's about kind of, I suppose, involving lots of different parties. So policymakers, also members of the public, patients involved in the decision making piece as well. So.
So you've lots of people having that dialogue together and understanding it from other perspectives.
Exactly. Yeah, exactly.
Yeah, very good. And I suppose what keeps you, I mean, I know myself from like I was a researcher back a million years ago, and I know like not every day in research is easy. Sometimes it can be hard. There can be things you have to work around, work through and everything. What keeps you going as a researcher?
Um, I suppose it is thinking about the end goal, and the end goal being to improve healthcare and to improve health outcomes for people. So, I mean, I suppose there's probably none of us who haven't encountered a health issue or members of our family who have struggled with health or healthcare. And I suppose that kind of comes back to me a lot of the time is that, well, who are we doing this for? It's for people that should have access to good healthcare. the healthcare that's as up to date and informed as it can be. So I suppose that's for me the driver.
Fantastic. Well, Elaine, Dr. Elaine Toomey, thank you so much for joining us on the HRB Where Are They Now series. And if you'd like to find other episodes, you'll find them on the HRB YouTube channel. But for now, from me, Dr. Claire O'Connell, Slán, and thanks for joining us.